Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about government policy and human rights. Welcome back to Depictions Media Radio. I'm your host, Michael Clogs, and we're going to have an update from the WHO on especially monkey virus, and for now they're saying that, of course, the major transmitter is men who have sex with other men, but there have been some possible cases where the transmission has gone to pets, and that will be discussed in this. But for now, they're saying that more than 7,500 cases were reported last week, with a 20% increase over the previous week, which was 20% over that, which starts to become alarming and concerning, meaning that we could be facing a bigger global health concern than what was previously thought. One of the things that they're going to be discussing is the possibilities of how a virus that is common more to another species of animal can be transmitted to human beings and then transmitted to other animals along with that. So they're going to talk about how mutations and how things can be transmitted along the way, has actually caused this health concern. There are still many countries, as we're going to hear in this press briefing, where reporters are asking questions from different countries around the world, and some are saying that their home country isn't necessarily taking the virus seriously, taking the health concern seriously, and seeing it as a serious outbreak, and releasing the information to the right people, the right populations, and putting the right precautions in place to help diminish the rate of infection and lower the mortality and the effects of the virus itself. So Dr. Tedros is going to have open remarks that will discuss some of that, and you'll hear from other reporters and different doctors as they discuss what is happening with monkeypox as well as with COVID-19, because COVID-19 is still out there. We're still in a global pandemic with COVID-19. While much of Canada has reopened and we've seen high vaccination rates in our country, there's still countries that have yet to see a vaccine and are still waiting for medications and help to arrive. So let's listen to what Dr. Tedros and his team at the WHO have to say about global health.
And I wish you welcome to a regular WHO press conference on global health issues. I will start by introducing our speakers here in the room and those who are online. Today we have Dr. Tedros, WHO Director General. We have also Dr. Sosefal, who is Assistant Director General for Emergency Response. With us is also Dr. Mariangela Simao, Assistant Director General, Access to Medicines and Health Products. Dr. Sylvie Briand is Director of Global Infectious Hazard Preparedness. Dr. Rosamund Lewis is a Technical Lead for monkeypox. And Dr. Abdurrahman Mahmoud is Incident Manager for COVID-19. Online with us is Dr. Mike Ryan, Executive Director of Health Emergencies Program. And we also have Dr. Rogerio Gaspar, who is the Director for Regulation and Pre-Qualification. We may have some other WHO experts also joining and who may answer questions. We have, as always, simultaneous interpretation in 6 UN languages and Hindi and Portuguese. Journalists who are online and would like to ask a question, please click the icon raise hand and you will be then put in queue to be able to ask your question after the opening remarks. And I give the floor immediately to Dr. Tedros for his opening words. Dr. Tedros.
Thank you, Tariq. Good morning, good evening, and good afternoon. First, an update on the global monkeypox outbreak. More than 35,000 cases of monkeypox have now been reported to WHO from 92 countries and territories with 12 deaths. Almost 7,500 cases were reported last week, a 20% increase over the previous week, which was also 20% more than the week before. Almost all cases are being reported from Europe and the Americas, and almost all cases continue to be reported among men who have sex with men, underscoring the importance for all countries to design and deliver services and information tailored to these communities that protect health, human rights, and dignity. The primary focus for all countries must be to ensure they are ready for monkeypox and to stop transmission using effective public health tools, including enhanced disease surveillance, careful contact tracing, tailored risk communication, and community engagement, and risk reduction measures. Vaccines may also play an important part in controlling the outbreak, and in many countries there is high demand for vaccines from the affected communities. However, for the moment, supplies of vaccines and data about their effectiveness are limited, although we are starting to receive data from some countries. WHO has been in close contact with the manufacturers of vaccines and with countries and organizations who are willing to share doses. We remain concerned that the inequitable access to vaccines we saw during the COVID-19 pandemic will be repeated, and that the poorest will continue to be left behind. As we announced last week, a meeting of experts convened by WHO has agreed to rename the 2 known clades of monkeypox virus using Roman numerals. The clade formerly known as the Congo Basin or Central African clade will now be referred to as clade 1, while the West African clade will be called clade 2. Work on renaming the disease and the virus is ongoing. Now to the Greater Horn of Africa, where millions of people are facing starvation and disease in Djibouti, Ethiopia, Kenya, Somalia, South Sudan, Sudan, and Uganda. Drought, conflict, climate change, and increasing prices for food, fuel, and fertilizer are all contributing to lack of access to sufficient food. Hunger and malnutrition pose a direct threat to health, but they also weaken the body's defenses and open the door to diseases including pneumonia, measles, and cholera. Food insecurity also forces some people to choose between paying for food and health care. Many people are migrating in search of food, which can also put them at increased risk of disease and reduced access to health services. While other partners are working to address the food crisis, WHO is addressing the resulting health crisis. We have already released more than $16 million from the WHO Contingency Fund for emergencies, but more is needed. The $123.7 million we are appealing for will be used to prevent and control outbreaks, to treat malnutrition, and to provide essential health services and medicines. In the Ethiopian region of Tigray, the drought is compounding a man-made catastrophe for 6 million people who have been under siege from Ethiopian and Eritrean forces for 21 months, sealed off from the outside world with no telecommunications, no banking services, no electricity, and limited fuel. As a result, the people of Tigray are facing multiple outbreaks of malaria, anthrax, cholera, diarrhea, and more. This unimaginable cruelty must end. The only solution is peace. Earlier this month, a delegation from the US, European Union, United Kingdom, Germany, Italy, and Canada visited Tigray in an effort to facilitate peace talks. Following their visit, the US and EU issued a joint statement saying that swift restoration of electricity, telecommunications, banking, and other basic services in Tigray is essential for peace talks to go forward. So far, the government has refused. Since the humanitarian truce was announced in late March, some humanitarian aid has been delivered to Tigray, although nowhere near enough. In addition, the shortage of fuel and cash continues to be a major impediment to the distribution of aid and to WHO's efforts to respond to outbreaks, provide vaccination against COVID and other vaccines, and deliver other life-saving services. Finally, on COVID-19. Over the past 4 weeks, reported deaths globally have increased by 35%. Just in the past week, 15,000 people around the world lost their lives to COVID-19. 15,000 deaths a week is completely unacceptable when we have all the tools to prevent infections and save lives. We're all tired of this virus and tired of the pandemic. But the virus is not tired of us. Omicron remains the dominant variant, with the BA.5 subvariant representing more than 90% of sequences shared in the last month. However, the number of sequences shared per week has fallen by 90% since the beginning of this year, and the number of countries sharing sequences has dropped by 75%, making it so much harder to understand how the virus might be changing. With colder weather approaching in the northern hemisphere and people spending more time indoors, the risks for more intense transmission and hospitalization will only increase in the coming months, not only for COVID-19, but for other diseases, including influenza. But none of us is helpless. Please get vaccinated if you are not, and if you need a booster, get one. Wear a mask when you can't distance, and try to avoid crowds, especially indoors. There is a lot of talk about learning to live with this virus, but we cannot live with 15,000 deaths a week. We cannot live with mounting hospitalizations and deaths. We cannot live with inequitable access to vaccines and other tools. Learning to live with COVID-19 does not mean we pretend it's not there. It means we use the tools we have to protect ourselves and protect others. Tariq, back to you.
Thank you, Dr. Tedros. We will now open the floor to questions, and we will start with the Financial Times. Donato Mancini is with us. Donato, please unmute yourself.
Hi, good afternoon. Thank you so much for taking my question. I actually have two. I'm so sorry. I was wondering if you had seen reports today that Bavarian Nordic is unlikely to meet demand for monkeypox doses. I know you have expressed concern on this, but I was wondering if you had anything else to say. Should the company explore partnerships with other companies? Should they do tech transfer? Should more manufacturers be called in? Are there any other vaccines that we should be looking at to respond to the monkeypox outbreak? And more broadly, given this resurgence of quote-unquote old diseases, such as polio or even monkeypox, is there a broad theme in why this is happening? Is this climate change? Is this global populations performing better surveillance? Is it a long tail effect of the pandemic on population immunity? I appreciate it's a broad question, but I'd be curious to hear your thoughts. Thank you.
Thank you, Donato. So there are really two distinct questions here. Maybe we start with the first one on monkeypox vaccines. Maybe Dr. Simao can start there, and then on the second question, Dr. Brian may help.
Thank you, Tariq, and thank you, Donato, for this question. It's actually WHO is in touch with Bavarian Nordic specifically, but also with the other manufacturers, first to ensure to understand supply and the hurdles to increase manufacturing capacity and availability of this of therapeutics and also of vaccines, and second to discuss potential opportunities for technology transfer and voluntary licensing of this technology. So, and we're talking about this in the context where we do need more data about both vaccines and the therapeutics. So this is work ongoing, and we were happy to update as we get more information and the negotiations with these manufacturers continue. Thank you.
Thank you, Dr. Simao. Maybe Dr. Brian can take the second question on re-emergence of pathogens.
Yes, thank you very much for this question. Indeed, we have seen in the recent past a lot of disease emerging and others re-emerging, and I think it's important to differentiate the two phenomena. For emergence is something that we know most of the emerging viruses are coming from animals. This is the case for monkeypox, and they infect human. So at the beginning it's only sporadic cases, but if the virus find the right environment, then it can evolve and become more fit for human, and then you can see localized transmission and further amplification again if the conditions are supportive for that, like high human density, very close contact, then you can have outbreak. And this is what we have seen with monkeypox. Initially it was in animals, then it went to some humans, and then we had localized outbreak, and now we have a multi-country outbreak. This is for the emergence, and of course there are many factors driving the emergence. You mentioned some of them, the climate change, but also human density in certain populations, certain human behavior can also foster this amplification. And also what is really important is the fact that we can stop those outbreaks at the source, but for this we need a very good health system, very good collaboration with the One Health approach, and so that's why it's so important to strengthen universal health coverage and primary health care, because this is why and we can then stop those outbreaks at source with a good surveillance, good healthcare system, and stop the spread when outbreaks are still localized. For the re-emergence, sometimes there are other factors playing out, and in particular for disease for which we do have tools for the control, like polio, like measles. The fact is that it's often because the vaccine coverage is too low that those diseases re-emerge. And it's very important to understand that vaccine coverage is a very, very important indicator of the protection of human beings against those diseases. And it's very important, therefore, to make sure that all children get access to these vaccines in due time, so that we can make sure that there is no cohort of human beings that are unprotected. And we have the tools, but we need to use them. And this is what is really important to prevent re-emergence. Thank you.
Thank you, Dr. Simao and Dr. Briand. And just to correct, the correct title of Dr. Sylvie Briand is Director of Epidemic and Pandemic Preparedness and Prevention Department. With that, we will go to next question. We have Erin Prater from Fortune Online. Erin, go ahead.
Hi, yes, thank you for taking my question. Just curious if there were any updates as far as mutations in the monkeypox virus. I believe CDC officials had said a month or two ago that they had seen at least 2 different strains. Curious if there's any update. Thank you.
Thank you, Erin. Dr. Lewis?
Thank you very much. We do continue to monitor the strains that are reported through genome sequencing that is put in accessible websites where scientists, evolutionary biologists, and pox virologists can look and review. So we have seen some mutations, but at the moment we don't have any information really on what that means in terms of the behavior of the virus itself or how it interacts with the human immune response. We'll continue to monitor that space.
Thank you, Dr. Lewis. We will now go to Helen Branswell from STAT. Helen, can you please ask your question?
Thank you for taking my question, Tarek. In the Director General's opening remarks, he mentioned that some countries are starting to provide WHO with some evidence about the efficacy of the monkeypox vaccines. Could somebody please elaborate on what is being seen? Thank you.
Thank you, Helen. Dr. Lewis?
Thank you, Helen. We don't have any randomized controlled trials of these studies in the context of this particular outbreak, so we don't have direct clinical efficacy studies, as I say, in the context of this monkeypox outbreak at the moment. What we are beginning to see is some observational studies reporting, for example, persons who may have had post-exposure prophylaxis after being exposed to monkeypox. They may have had the vaccine. Again, just a couple of reports are coming out, and we have known from the beginning that this vaccine would not be a silver bullet, that it would not meet all the expectations that are being put on it, and that we don't have firm efficacy data or effectiveness data in this context. So what we are beginning to see is that some cases are being reported perhaps as breakthrough cases, either following post-exposure prophylaxis, which is meant to reduce disease severity, or following preventive vaccination, which is meant to, of course, reduce infection. And we don't yet have any as I say, randomized controlled trials specifically on that. But the fact that we're beginning to see some breakthrough cases is also really important information because it tells us that the vaccine is not 100% effective in any given circumstance, whether preventive or post-exposure. We cannot expect 100% effectiveness at the moment based on this emerging information. So again, this is not new. In the past, based on a very limited study from the 1980s, it was already suggested that the smallpox vaccines in use at that time, which were also powerful replicating vaccines, might offer about 85% protection against monkeypox, and that was really one study in an area where some people were vaccinated and some people were not, so they could compare that. However, that's really all the information we had, and the vaccines we have now are developed in order to be safer, but they're also non-replicating. So we are not expecting 100% efficacy for these vaccines for the prevention of monkeypox. We don't know the exact information. What we're seeing are breakthrough cases, which are not really surprises, but it reminds us that vaccine is not a silver bullet, that every person who feels that they are at risk and appreciates their own level of risk and wishes to lower their own level of risk have many interventions at their disposal, which includes vaccination where available, but also includes protection from activities where they may be at risk, reducing number of sex partners, avoiding group sex or casual sex, and specifically when a vaccine is in fact administered, waiting until that vaccine has the time to produce a maximum immune response. In the case of MVA vaccine, this is 2 weeks after the second dose. So again, it's not a magic bullet. People do need to wait until the vaccine can generate a maximum immune response, but we don't yet know what the effectiveness will be overall.
Thank you, Dr. Lewis. Next question is for Bianca Gauthier from Globo, Brazil. Bianca, can you hear us?
Yes, can you hear me, Tarek?
Yes.
Thanks a lot for taking my question. I believe it's the first press conference in 3 weeks, so I hope you had great holidays. And I take the opportunity to make two questions. First, regarding Brazil, when we see the WHO dashboard for monkeypox confirmed cases, Brazil is already the 5th country in the world. So it seems the disease is spreading much faster in Brazil. Am I wrong? And how do you explain this quick spread of the virus in Brazil? And the second is, if you could comment on the first possible case of human-to-dog transmission of monkeypox. Is it a surprise? What are the precautions to avoid this kind of transmission? And what are the risks for pets? Thanks a lot.
Thank you, Bianca. Dr. Lewis.
Sure. Thank you very much, Bianca. Yes, a number of countries are showing concerning trends, and Brazil is one of them. The number of cases does continue to rise, and it's really important for all public health interventions that are available in the country to be put in place and for individuals to be given the information they need to protect themselves. And WHO, both the headquarters, of course, and the regional office with the Pan American Health Organization are there to support the country, and the country office is also there to support Brazil. It's really important that Brazil have a strong response in terms of information. Remember, our strategic imperatives for this response are information, action, and evidence. So people who are at risk in Brazil, as everywhere else, need the information that they need to protect themselves by knowing what types of settings and which types of activities may put them at risk. Action in terms of public health response, engaging with communities is one very strong action, engaging with affected groups, and of course collecting the evidence on what works and what works less well. So this is what's critical for Brazil right now, as access to other countermeasures is, of course, being worked on and scaled up as soon as possible. Regarding the incident of the dog, yes, so this is the first case reported of human-to-animal transmission. This has not been reported before, and we believe it is the first instance of a canine being infected. However, this has been a theoretical risk. You may see that a number of public health agencies have advised those who contract monkeypox to make every effort to isolate from their pets or to isolate their pets from themselves because of this hypothetical risk, particularly both in the household for domestic pets as well as in possible risks of contamination of animals outside the household. For example, rodents accessing garbage and things like that. So waste management is critical. Isolation is important. These are some of the lessons that have been, some of the messages that have been given on a precautionary basis to avoid contamination, infection of pets, and to avoid possible spread of the virus into other animal populations in countries where this has not occurred before. So while these have been hypothetical, theoretical risks all along, we believe that they are important enough to have this as part of the response, that people should have information on how to protect their pets as well as how to manage their waste so that animals in general are not exposed to the monkeypox virus.
Thank you, Dr. Lewis. We'll go now to The Economist. We have Slava Chankova with us. Could you please unmute yourself and ask the question?
Yes, thank you for taking my question. You mentioned that there are more than 75,000 cases reported to the WHO. Are those confirmed cases, or they include suspected cases as well? And my second question is, you said that the outbreak in non-endemic countries is still concentrated in men who have sex with men. Is there evidence in any of those countries that it is spilling over to the general population in significant numbers?
Dr. Lewis.
Thank you, Tarek. So the report we have today is over 35,000 cases, not 75,000. So just for clarity, 35,000 cases in 92 countries reported to date. These are confirmed cases. WHO reports confirmed and probable cases. There are, of course, other situations where suspected cases are reported, but may not have had the ability, access to testing or the ability for laboratory confirmation. So 35,000 are confirmed cases. Regarding the, sorry, I've forgotten the second question. Oh, the spillover, thank you. So regarding the outbreak in men who have sex with men and whether it's affecting other communities and other groups, yes, we are seeing, of course, sporadic cases in men who are not self-reporting as gay or bisexual, who are otherwise also reporting as heterosexual where the information is available, in some women, in other groups of people who have a larger number of sexual partners, and in some cases in children, some of whom are adolescents, age 15, 16, 17, who may also be engaged in sexual activities, and then a small number of cases in children under the age of 10 or under the age of 5. At the moment, these remain sporadic cases. There does not appear to be extended transmission from those within their own peer groups. And so this is in a very important space that we watch very closely, and important for everyone to realize that even though the outbreak is spreading in men who have sex with men, and this is our primary group that we concerned should receive the information they need to protect themselves, it is also important that, yes, anyone who is in close contact with someone who has monkeypox can also be exposed, whether in the household setting or in the occupational setting. We do have some new information there, and also in other settings where people may have multiple sexual partners. So thanks for the information, for the question. We are still monitoring that very closely.
Thank you, Dr. Lewis. Next question, Vijay Shankar, who writes for Lancet. Vijay.
Thank you very much, Tarek, for giving me the floor to ask the questions. I have two questions. So FIND came up with a database of monkeypox diagnostics, but mentioned that they are not testing the specificity or sensitivity of those. So is WHO planning to commission any studies to examine the quality of these, especially rapid diagnostic kits or any novel diagnostics? So that's the first question. The second one, how does WHO compare any sort of latest developments in monkeypox diagnostics between high-income and low-income countries, especially with respect to ensuring equitable access? Thank you.
Thank you, Vijay. Maybe Dr. Lewis can start.
I can start. So for the diagnostics, our laboratory teams here in headquarters, as well as in all the regions and countries around the world, are working very hard to bring a diagnostic capacity to countries, particularly lower and middle income countries that need support in accessing diagnostics. So this primarily at the moment remains PCR. There are some commercial entities that have been validated through a WHO process and therefore recommended for direct procurement and or support to countries directly so that they have the test kits necessary to do the PCR testing. At the moment, there is not yet to my knowledge, a validated rapid test, which is also a space that we are monitoring on an ongoing basis. And WHO would certainly be engaged in validating rapid tests if they become available. We know that a number of entities, whether academic or commercial, are working in this area, and so we will continue to monitor that and bring information to you when we have it. Regarding the latest developments in high and low-income countries, I believe that question was about access. So I will refer to Dr. Mariangela.
Thank you. Thank you for the question, Vijay, and I think you covered most of it, Rosamund. But just to add that, of course, access in low and middle-income countries is a very reasonable concern for all of us, and we are working, as Rosamund just mentioned, with developers and organizations that work with manufacturers to develop new technologies, including and most importantly for the rapid diagnostic tests that you mentioned, to be developed and be available at affordable prices for the developing world. So this is work in progress at the moment.
Thank you very much. And then we will go now to Nina Larsson from AFP. Nina, please unmute yourself.
Yes, hi. Thanks for taking my question. I just wanted to go back to Bianca's question on the case of the dog who's infected by humans. Just if you could say a little bit more about what the main concern would be about that. If it's the fact that the virus can spread further, if it's spreading in animals and humans at the same time, or if you're concerned that we'll see more dangerous mutations, perhaps if the virus is spreading in different species. Thank you.
Dr. Lewis again.
Sure, thank you, Nina. So first of all, the concern is, of course, for the household where infection may be occurring. We're not talking about this particular case, of course. We're talking about households in general. There are other members of the household, adults, children, and pets. And so obviously the concern is to prevent infection of any member of the household and, of course, prevent onward infection from any member of the household to any other member of the household, which we have seen happen in other outbreaks in the past. So protecting members of the household through isolation, through regular cleaning, these are all important strategies and tactics to help for people to protect the ones that they are closest to, their loved ones in their homes as well as in their communities. Regarding movement of the virus into an animal population outside the household, certainly as soon as the virus moves into a different setting in a different population, there is obviously a possibility that it will develop differently and mutate differently. That's a theoretical possibility. Right now, we don't have information on that because we don't have any reports. We are working closely with the World Organization for Animal Health, and they also have Q&A on their website, and we do work with them on these issues to bring attention for those who are working in this space. I think Dr. Creon would like to add.
Let's just go first to Dr. Mike Ryan, who wants to add something on this, and then we may hear from Dr. Brian as well. Dr. Ryan, go ahead.
Thanks, and Sylvia making the same point that I'm about to make. It's just, again, in terms of caution, clearly in this particular case with the transmission to a dog in a closed domestic setting, with having one animal infected is not unusual. It's not unexpected that would happen. What we don't want to see happen is disease moving from one species to the next and then remaining in that species as a species, moving around within a new species, because that's where the virus can adapt to that new species. And in adapting to that new species, it is incentivized to evolve as such. We see this, and this is probably the more dangerous situations, as we've seen in other situations, is where a virus can move into a small mammal population with high density of animals. And then it is through the transmission between one to the next to the other animal. And it's through that process of one animal infecting the next and the next and the next that you see rapid evolution in the virus. So it's usually amongst those smaller mammals where you see a virus being able to move quickly in a dense population, and then the virus evolves very quickly. I don't expect the virus to evolve any more quickly in one single dog than in one single human. So in that sense, in this particular situation, this particular animal is the member of a human family, and is just an animal unfortunately exposed to the virus. And in that sense, we want to make sure that anybody around a person, a case, that you don't infect people in the household with you, you don't infect animals in the household with you, that can be avoided. So having that normal precaution of not infecting humans or animals around you is very important. And but not to become overly concerned in general. And for people out there, pets are not at risk in the same way as most of the general population are not at risk of contracting monkeypox. We need to remain vigilant. We need to remain cautious. But at the same time, animals and pets do not represent a risk to people right now. It is important, and it is to be commended when people who have animals either try to protect those animals, or if those animals become sick or become infected themselves, that they seek care for those animals, as has happened in this case. So those individuals are commended for the action they've taken. So in that sense, I think it's important that we don't allow these viruses to establish themselves in other animal populations. Single exposures or single infections in particular animals is not unexpected, however. Thank you.
Yeah, just to complement, thank you, Tarek. To complement a bit, we have seen those infection in the past with other zoonotic viruses where they contaminate a new species, but usually it's a dead end. I mean, it stopped there because the virus is not very fit for this species, and so sometimes it's only stopped there, and it's just one case. So here, what is interesting, as Rosamund mentioned, is that we never had those kind of reports, so it's the first time. It means that a dog can be infected, but it doesn't mean that a dog can transmit the disease and infect other dogs, nor does it mean that the dog can reinfect human if it is infected. So I think what we try to really here to give as a message is what we need is to be cautious, as Mike said, vigilant, and prevent further transmission, because those viruses, the more they transmit, the more they can evolve. And every time they invest or infect a new species, they can acquire different properties and then evolve. So it's very important just to monitor the situation and all together be vigilant and prevent further transmission. Thank you.
Thank you all. We will now go to Bloomberg. We have Dong Liu with us for next question. Dong, can you please unmute yourself?
Hi, thank you. I just wanted to follow up with a question on the monkeypox vaccine. When earlier you were talking about breakthrough infections, I just wanted to ask if you could elaborate a little bit on how many doses those people who had breakthrough infection had before they had a breakthrough infection, and also could you provide an early estimate in terms of how often this has happened? Thank you. No, so is this the Genos vaccine?
Donga, I think the question was about breakthrough infections among the vaccinated people. Dr. Lewis?
Yeah, thank you. I didn't hear the second part of the question very clearly. The first part of the question, I don't think we're going to discuss individual studies here today. So as that information continues to come in, we are monitoring it extremely closely. What we would like to see is some randomized controlled trials, wherever that may still be feasible, and supporting countries to do that, and also some observational studies wherever vaccine is being rolled out. There are different study designs that can also be attempted to support what information we can collect in the context of the rollout of the vaccines. And we do expect to have this type of information coming out, which does not give us the whole answer because they're not randomized controlled trials. And over time, we will need to triangulate all that information to see what are the best estimates we can come up with.
Thank you, Dr. Lewis. We will now call on Gabriela Sotomayor from Mexican outlet Proceso. Gabriela?
Hola, thank you. Thank you very much, Tarek. Nice to see you. On monkeypox, in Mexico, the cases have doubled in a week. They are not doing tests. And on the website of the health secretary of the health minister, there is no clear information, nor are men warned that they have sex with men. And, you know, there's no warning at all for men that have sex with men. So about vaccines, there are no vaccines. So I would like to know your comments, to hear your comments on the situation and what could happen in Mexico if this continues like this. And second, if you allow me another question on Ukraine. If you can comment on the Russian attacks against the Zaporizhia, I don't know how to pronounce it, the nuclear plant. the dangers to which the population are being exposed. There may be a catastrophe there. So I would like to hear your comments, your concerns, and if you communicated with the Russian government on this matter. Thank you.
Thank you, Gabriela. There are two separate questions. Let's go to Dr. Mike Ryan to see if we can address some of them. Dr. Ryan.
Hi. Great. Thank you. I think we will follow up directly on Mexico. This message is for all countries. Countries need to obviously take monkeypox seriously. I'm not aware of the specific issues you refer to in Mexico, but we will follow up through our Pan American Health Organization, our American regional office in Washington, and engage with the government in Mexico. My understanding is the government of Mexico do take this epidemic seriously and are taking action. But we will take up your concerns with them and be assured of that. I am glad to take your second question on Ukraine. I'm glad somebody asked a question about somewhere else. I was quite surprised. I know this is quite a specialist group, but it's interesting to be asked questions only about monkeypox, even though we have 15,000 deaths from COVID and we have a massive drought and a massive famine emerging in the Horn of Africa. And yet all of the questions relate to monkeypox, which shows how much interest there is in monkeypox. But it also shows, quite frankly, how interest is declining in COVID and how really no one seems to give a damn about what's happening in the Horn of Africa. With regard to Ukraine, we have been involved since the very beginning with the authorities in Ukraine and through the IAEA and the REMPLAN initiative in order to be ready to respond to any radionuclear incident that might occur. We have been, and the Director General is on the record, stating his concerns regarding the possibility of any form of radionuclear accident in or around one of the existing nuclear plants. We're in constant communication with the IAEA and remain ready as a member of the UN system to react if there's a need to react. A nuclear accident obviously would be catastrophic in this situation to human life and to the environment. So we do remain concerned about that, but we are guided by our colleagues at the IAEA and will continue to offer medical response support to them and to the government of Ukraine. Thank you.
Thank you very much, Dr. Ryan. The sound was not best on this last question, but we will have a transcript of this press briefing posted tomorrow morning in case there was an issue with audio and understanding what Dr. Ryan has said. I think we have time for one more question, and we have Simon Ateba from Today News Africa with us. Simon, please go ahead.
Good morning. Thank you, Tariq, for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. The U.S. CDC is ending recommendations for social distancing and quarantine for COVID-19 control and no longer recommend tests to stay in schools. I was wondering if you could react. As people get tired of these very strict public health measures, and we learn to live with COVID-19 with vaccine and therapeutics, is this something that the WHO will also recommend soon? And on Tigray, the U.S. government said last week that things seem to have been going very smoothly since the humanitarian ceasefire in March. But Dr. Tedros just said that things seem to still be very difficult and help is not reaching people in need. Can you please talk a little bit more about the situation there and hunger in the Horn of Africa in general? Thank you.
Thank you very much. Maybe we start with a question on COVID, and we have Dr. Mahmoud with us, who is Incident Manager for COVID-19. Dr. Mahmoud.
Thank you. Thank you for raising, I think, the main question that Mike alluded and the DG said in his speech, that the idea that we can live with a virus that just killed 15,000 last week, it's something that we can still struggle wrapping around it. Yes, we are tired of it. The public is tired of it. Even us, we are tired of it. But the virus is not tired of us, and every day is bringing new tricks and its live. Over 200 Omicron subvariants are recorded. Some of them are gaining more momentum. So there are a lot of the things the population can withstand. I think the resilience of the communities, if risk is explained very well, can be done. So every member state has to do risk mitigation and look at the national level. So we are aware about the US CDC's guidelines and how they will be handled at the national. But on the other side, we have in the same US, we have last week alone almost 100,000 population hospitalized, 500 deaths a day. That's 3,500 a week. It's almost one of the leading cause of death in the US. On the other side of the world, Japan, Pacific Islands, for the first time I struggle. Multiple countries are struggling. Sadly, we are still in the midst of the pandemic, and every wave is kind of starting again. We need to come together to resolve. It's not a pandemic is once in a lifetime, and it's not a switch on and off that someone can decide this is today what we require. What we have been calling is really simple, basic measures that are cost savings. We need to share them equally. And even in the richest country, the people who are suffering will be the low middle income countries, the marginalized, the ethnic minorities who don't have the luxury of getting some of the recommendations. So to sum it up, WHO has always called a risk-based approach to use data to make the decision at the lowest level, because a big country cannot make a decision for that. So that's our main recommendation. We just updated our guidance in quarantine, in isolation, in surveillance, which are all leading to it to find the balance. One is to suppress the transmission or to control the transmission while also reducing the morbidity and the mortality, taking into consideration the socio-economic and the fatigue of the communities. So our message has remained really the same, is we have the tools, we need to share them equally, we need to explain to the people that pandemic are once in a lifetime and not a small epidemics that you can come out of it. Thank you.
Thank you, Dr. Mahmoud. Maybe Dr. Sosefal can speak on other questions that Simon had asked.
Thank you, Tariq. Thank you, Simon, for the question on Tigray and Greater Horn of Africa. The situation in Tigray clearly is still very, very difficult. We are talking about blockade for more than 2 years, and still access to fuel for humanitarian workers is a big challenge. Humanitarian actors need 2 million liters a month, and since April 1st, they have received less than 2 million liters. So the supply of medicine is still very challenging for WHO and partners. We have big delays because of the permit authorization to supply, in Tigray. And if you look at the level of disruption and lack of access to health services where health workers were not paid, it will take months and months for the system to recover. In the meantime, we have already lost so many people, so the recovery will take very, very long. And we are not even yet filling all the needs, even to talk about recovery, making sure that we have full access and the supply is permitted without any restriction will be extremely important. And if you look at functionality of health services and reporting, we have seen now around 50% of the health facility reporting, meaning that even to be able to detect and respond to outbreak is very limited. The situation is, has been exacerbated by the situation in the Greater Horn of Africa. Today we are talking about more than 20 million people in Ethiopia that need support for humanitarian, needs. If you look at the Horn of Africa, the total population is close to 200 million, but we already have 80 million people in a very acute food insecurity situation. And when you talk about food crisis, we are already in a health crisis because of the many reasons already explained by Dr. Tedros in the opening. So we have seen so many outbreaks of cholera, measles, malaria, meningitis in so many countries. In addition to that, the lack of access to primary health care because of the number of internally displaced population. We are talking about 11 million population now displaced and 4.2 million refugees. So, and WHO is looking for $124 million to cover the health needs. So far, we are only covering 12% of the need, and mainly from the WHO contingency fund for emergencies, thanks to our partners for the support. But we need much more in a bigger scale and very rapidly if you don't want to lose millions of children and millions of population. Thank you.
Thank you. So We can go for one more last question. This time it will be the last one, and it's Lauren Pelly from CBC. Lauren, you have the last question of this briefing.
There's a significant amount of debate and questions online regarding how exactly it transmits. Is it airborne? Is it, you get it from a clothing store? And amidst all of that, there's actually so much misinformation circulating as well. How concerned is the WHO regarding the level of misinformation around monkeypox, much as we've seen with other illnesses and diseases? And do you have any strategies to sort of combat what is a rather rampant amount of information circulating these days?
Thank you, Lauren. So that's about misinformation, how much we are concerned. So maybe Dr. Sylvie Briand can try.
Okay. Thanks a lot, Lauren, for this question. Indeed, I think we have seen that every epidemic or pandemic is accompanied by this misinformation. So it's not new. It's just what makes it more difficult probably to combat is the fact that now a lot of the population of the world is connected and it's spread through social media. And so it spread faster and further than what we had observed before. So WHO is concerned by this because this misinformation first can really hamper the response to the outbreak because people can maybe take some treatment that are presented as miraculous, but in reality they are not treating them and could be poisoned, or they can maybe refuse the vaccine that can save their life. So the impact of misinformation on people's behavior is really concerning, and that's why it's WHO is really doing a lot of effort to combat it. What we do exactly? First, we listen on social media what are the concerns of the people so that we can provide them with the right information at the right time and the right format. And this social listening is extremely important to first understand what kind of information is needed. The second thing we do, we also work very closely with the communities, and in particular for this particular outbreak of monkeypox, as you know, because men having sex with men, it seems to be the communities that is currently the most affected. It's very important to reach out to this community and having direct discussion with them and trying to understand how we can support them in preventing them to be infected. And so we have here a department for HIV and sexually transmitted disease, and so they have been extremely helpful to discuss with these communities and provide them with the information that they could need to prevent the transmission. Then what we do, we also identify the places where people might be exposed and have a specific information during those situations. For instance, there was at the beginning some amplifying events such as a big mass gathering. So it's important to work also with the people organizing those mass gatherings and people attending those mass gatherings so that the right information can be discussed at this meeting. And of course there is a lot of work done, but this is not specific for monkeypox. It has been done also for COVID-19 with the social media platform to try to triage and select the information that is pertinent and accurate so that people can have access to this information more easily and or have the tools to understand if an information is accurate or not, and support them in acquiring not only this health literacy but also this digital literacy where they can grow their capacities to differentiate misinformation from accurate information. And so this is a whole program of work because we we think that this is one of the main challenges that we are facing in the 21st century. The science has made fantastic progress. We have access to vaccine, to therapeutics, and really it's really concerning if people cannot have access to this progress of medicine because of misinformation. And I think we have all a role to play. I think journalists in particular, you are really important messenger and really important trusted sources of information for the population, and it's very important that we all see this as our collective responsibility to make sure that people have access to the right information at the right time in the right format. Thank you.
Thank you very much, Dr. Briand. We all have a role to play. With this, we will conclude today's press briefing.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.